Choosing a plastic surgeon is one of the most stressful decisions you'll make, because this isn't just about a procedure. It's about how you're going to feel in your own body every single day after. So in this video, I'm going to walk you through how to actually choose the right surgeon, and more importantly, whether I am the right one for you. Let me start out by walking you through my background, where I trained and how I got here. My medical school training was at the Johns Hopkins University School of Medicine. For those individuals who are not familiar with Johns Hopkins, it is one of the top universities and top medical centers in the country. Following my medical school training, I was fortunate enough to stay at Johns Hopkins Hospital for an ophthalmology residency. During that training, I was captivated with eyelid and facial plastic surgery, as I got a chance to work with some of the great oculoplastic and facial plastic surgeons. Following my residency training, I was fortunate enough to be recruited to a very prestigious, arguably one of the top oculoplastic and facial plastic surgery fellowships in Salt Lake City, Utah, with Dr. Richard Anderson, who is considered by many father of oculoplastic and facial plastic surgery. There I spent 2 years training in eyelid and facelift procedures, as well as a lot of reconstructive surgery involving eyelids, orbit, and tear ducts. Reflecting back on my training, there was a specific moment that made me realize that I wanted to pursue the field of oculoplastic and facial plastic surgery. I remember as a first-year resident working with one of my attendings, Nicholas Iliff, who has been known as one of the greatest oculoplastic surgeons in the country. So when I was watching this operation, was assisting with this operation, I knew that this is what I wanted to do. It was probably one of the most artistic and beautiful procedures that I've seen to date. The procedure captivated me because of how the procedure was performed, how delicate the sutures were, how skillfully the surgery was executed, and how much skill and technical ability was necessary to create a very beautiful eyelid result. After the operation, I was fortunate also to continue observing this patient's results, and that patient was super happy, had improved vision, and looked 10 times better than before. And so combination of watching the surgery and the patient satisfaction were really integral to my decision to pursue this field for my entire life. So I became captivated with oculoplastic and facial plastic surgery due to its artistic nature and ability to improve both function and cosmesis, meaning patients coming in with a droopy eyelid have both visual limitation and cosmetic concerns. So addressing both is very, very rewarding. In addition, patients who are aging and have a lot of facial concerns and facial droopiness are really grateful after you're able to restore those structures to their more youthful and pleasing appearance. One thing I realized during my training and early career, as I became more and more competent in this field, is the huge breadth and huge variety of the procedures that we as oculoplastic and facial plastic surgeons offer. This ranges from reconstructive surgery, so patients who are suffering from life-threatening cancers, to those individuals who are trying to improve their appearance. Something as simple as just getting injectables like Botox or filler. Also, a lot of people don't realize that to be a competent surgeon, we have to go through very, very rigorous training for many years, rotating through multiple different disciplines, including general surgery, ophthalmology, vascular surgery, and deal with a lot of life-threatening conditions. Most people do not think of us as surgeons who restore function and do reconstructive procedures to save people's lives and improve their quality of life, in addition to just making them look better. When you're looking for the surgeon, you want to look not only at one's qualifications and training, but also their passion, how much they care, how much they love their field. And you can't fake that. This is apparent when you watch their videos, when you talk to them in person. My extensive experience during surgical training and academic endeavors have really shaped the way I approach surgery today. Specifically, to me, psychological aspects of surgery have become more and more important. What I mean by that is ensuring that patients are ready for the operation, that they have the right expectations, and that I can deliver those expectations seamlessly and satisfy their needs, satisfy their goals. And this is probably the hardest aspect of plastic surgery, cosmetic surgery, to learn as a surgeon. And we do need extensive experience and exposure to many, many years of training and practicing surgery to learn this well and to appropriately consult patients preoperatively. And one aspect I found that many surgeons do not emphasize enough is the postoperative journey or postoperative recovery. It is easy to make promises. It is easy to look at the very, very final result. But it is important to understand that this is a process. It is a marathon. And so the healing occurs over time. We have to ensure that our patients are prepared for this journey. And we're there, and I'm there, along with my entire team, to make sure that you get through this successfully through ups and downs of recovery. The main fear or the main concern that I hear from patients is looking unnatural. So looking too pulled or looking weird after the surgery. And that happens because they see other individuals who've had cosmetic surgery either in person or on television or on social media that do not look normal. Fortunately, those individuals make up a very small portion of the entire pool who gets plastic surgery procedures. But the ones that actually have great procedures and great outcomes, which really make up the majority of the population who've had plastic surgery, are just not seen because they look natural, they look rested, they look good. So it is important to do your homework. It is important to seek the right surgeon to ensure that your results are natural and to avoid complications and looking unnatural. When we're planning a surgical procedure, we do not only focus on the anatomical improvement or physical improvement that the patient achieves. It's really about one's satisfaction and one's happiness with the procedure. And that doesn't always correlate to the anatomical improvement that we can achieve. And so this is kind of going back to earlier discussion with managing expectations, make sure that the individual who is seeking a surgical procedure is in the right mental space, in the right point in their lives to undergo the procedure and be satisfied or happy with the final result. Most people, before they come to see me for a consultation, have a mix of feelings. So they're excited, but they're also very anxious. When they finally come in for a consultation, their blood pressure can be high, and you could tell that there's a lot of anxiety, but also a lot of sort of pent-up, excited emotions that are hiding there. So all of those feelings are normal, and so we're here to make you feel relaxed, to make you feel comfortable, and to fully educate you on the procedure. So to hopefully calm your nerves and also not to damp your excitement and ensure that you're continue to look forward towards the procedure. So a lot of patients come in and they have an idea in mind of what they want to look like. And sometimes that can be difficult to communicate, to properly explain to the surgeon. I do believe that most people are interested in looking very natural, but still have a significant improvement compared to their baseline, compared to how they came in looking like. So this balance between natural appearance, looking like they've never had surgery, but also a significant change where they look more awake, they look rested, they look less concerned. I think that balance is what most people are looking for, but sometimes struggle to explain during their consultation. The way we as a practice help patients feel confident in their decision is by thorough education. So ensuring that folks watch the educational videos that we have available, read the material we have on our website, on social media, and also spend enough time talking about the procedure, asking questions both from myself, our staff, ensuring that we answer all of their questions even after their consultation. So I think once the patients are educated and they gain trust that the surgeon and the staff are competent and knowledgeable and experienced in the procedure that they're seeking to have, creates a very comfortable situation, and a lot of patients feel very safe to proceed with surgery after that. So our process from consult to recovery involves several steps. Once you book the consultation, you meet with myself and we spend sometimes close to an hour, discussing the surgical options that would be the right fit for you and for what you're looking for. After that, you meet with my surgical coordinator if you decide that this is something you want to move forward with, and the information on the scheduling and the costs for the procedures involved is obtained. Following that, if you do want to move forward with the surgery, we have a preoperative visit where, again, I meet with you, we take additional photographs, and my staff goes over the preoperative, postoperative instructions, and any other details or questions you may have. During surgery day, you come in earlier, about an hour earlier, hour and a half earlier than your procedure is scheduled, and then you get ready for the surgery. Let's say if the surgery involves some sedation, you get an IV into your vein, and then the nursing staff gets you ready for the procedure. I see you again and talk to you, mark the areas that we're going to be operating on. We perform the surgery, then you are in the recovery for a little bit, and usually it's an outpatient procedure. You go home, you do need someone with you to drive you back and ideally spend the night. Following the surgery, depending on the type of procedure, I either see you the next day or within about 10 days after your procedure. And then we see you frequently to ensure that your recovery is seamless, and we are always available to make sure we answer all of your questions and concerns via text message or phone call or any other means necessary. We do not leave you until you are fully satisfied with your results, and so we can see you for as long as necessary after the surgery until you're completely healed and completely happy at no additional charge. Our goal as a practice is to ensure that our patients look very natural and the results actually fit you as a person. So to make sure that happens, we do not do the same operation for every person. So meaning we have to customize the operation to you as an individual. For example, somebody who's getting a facelift, the way we do the facelift and what additional procedures we recommend vary significantly depending on one's anatomy, one's goals, one's age. It is a complex question, but at the end of the day, you have to treat a person as a unique human being and tailor the procedures and tailor the recommendation to their particular needs. With this approach, we can achieve the most natural results and achieve the highest satisfaction rate possible. So some of the changes we notice in patients beyond restoration of more youthful, more rejuvenated appearance are also psychological changes. So initially, right after surgery, patients are overwhelmed. There's a lot of swelling, there's a lot of bruising, and so there's a little bit of a period of a postoperative blues, if you will. However, shortly after that, so within a couple of weeks after that, as the patients start seeing their new shape, their new look, patients become very excited and very happy, and it is so rewarding to see that when people come in with smiles. I feel like that propels a lot of patients to improve their lives overall. This one change, let's say their eyelids are looking better, or their eyes are more open, prompts a lot of people to improve other aspects of their lives. And I think that is a change that not many people think about or talk about, but it's almost, the surgery becomes almost a catalyst for those positive changes that individuals undertake afterwards. So a lot of patients are very, very happy, very satisfied with their results, and that is probably the patient satisfaction and their feedback to me afterwards is probably the most satisfying part of my career. There's not a day where I don't hear somebody telling me that we've changed their life, we've made their quality of life, all of the aspects of their life, including work, relationships, much better. Now, that is not the case for everybody, so I don't want to set those expectations for everyone, but we do see that experience, because both groups of patients, those who are mostly concerned with their look, or those who are in need of reconstructive surgery, suffer greatly from those problems that they come in seeking consultation for. And so if that's truly the source of their dissatisfaction, correcting those aspects again changes a lot of other parameters, a lot of other variables in their lives. So for people who are unsure, on the fence, very nervous, they are bothered by a certain aspect of their appearance, but they're just don't have the confidence or are too anxious to seek consultation, I would say the most important piece of advice is to do your research, to make sure you educate yourself very carefully, not only about the procedure, but the surgeon you're looking to obtain a consultation from, and also not to feel pressure. Luckily, most cosmetic operations that we offer are not urgent. They're not necessary, and they're not essential to perform right away. So taking your time, making sure that you're in the right space, mental space, physical space, to not only proceed with surgery, but also proceed with the consultation. So taking that pressure off of you that you have to do it now, that if you don't do it now, you will never have it done, or you will not have the success in life, it would be very helpful. So in summary, education, taking the pressure off, making sure you do your research and educate yourself about the surgeon and the procedure. I think all of those factors are very important to relieve some of the anxiety. If you'd like to learn a little bit more about myself and our practice, feel free to contact us through our website or by calling us directly at 208-900-4673 to schedule a consultation, and we will accommodate you without any difficulties.